All right. Okay, well, this is just a little presentation on dry needling for public health. So thank you for, oh yeah, for being here. I'm Ariel, another physical therapist here at Renew. And so I'm certified in dry needling, and it's something I really enjoy doing in the treatment plan for some of my patients. So what is dry needling? Dry needling is a skilled technique and treatment that uses a very small needle placed into some type of usually symptomatic tissue, and that can be muscles, tendons, ligaments, capsules. We can also needle into scar tissue and vascular regions to affect change in the body for more neuromusculoskeletal conditions, pain, movement impairments, and disability. So there's a wide application of that needling use. Placement of the needles is based on the patient's own evaluation findings and their own unique presentation of their symptoms and their pain or dysfunction. And then when working in pelvic health, there really is no one size fits all with the needling, but I'll get more into that later into the presentation. So the needle varies in its size. So it needles in its diameter and its length, depending on where in the body we are trying to place that needle and also what condition we're treating. Safety and comfort is always the main focus with treatment. So needling size will also vary on the individual's just own presentation, their irritability level, their pain tolerance. Dry needling uses this, can you see the pointer? This very thin, solid monofilament needle that is inserted into the soft tissue. This needle diameter ranges in its diameter, but it's typically between 0.15 to 0.35 millimeters, which is, as you can see, significantly smaller than a sewing needle, and that's significantly smaller than what you would get with a medical syringe often used. We call this medical syringe wet needling. Wet needling uses this hollow bore needle that is required to have space for that injectate or that fluid that's going to be inserted. That fluid could be corticosteroid, anesthetics, or other substances. So you can see that needle size is significantly larger than the dry needling monofilament. Whenever medication is added to treatment, the likelihood of side effects like skin discoloration and just tissue damage also increases, and that's simply because of the size of that needle being used. And that's just another reason why dry needling is still considered that more conservative treatment that doesn't produce those kind of significant side effects that you might see with these larger needles when you're having injections. So a common question asked is dry needling the same as acupuncture? So no, dry needling is not the same as acupuncture or traditional Chinese acupuncture. Dry needling uses a different methodology and philosophy than your Chinese acupuncture does. So acupuncture uses ancient Eastern medicine principles like meridians and qi that were developed thousands of years ago to treat physical, mental, and emotional pathologies. Dry needling practices based on the foundation of modern Western medicine principles such as neurology, physiology, anatomy to treat neurophysiological pathologies that might manifest as decreased range of motion, or strength, function, and pain. So since dry needling is based in modern science, it will continue to kind of evolve and advance as new laws of medicine also develop. So while acupuncture and dry needling utilize the same very thin monofilament needle, their ideology and treatment approach is significantly different. This explains how a traditional acupuncturist, when deciding where and why to needle, would be entirely different from a practitioner of dry needling deciding on where and why to needle. So the application standpoint is very different. And then to take this differentiation one step further, I am a practitioner of integrative dry needling, which is a little different than just the trigger point dry needling. So in some patient presentations, and we're thinking more of like acute type of symptoms, you've maybe only had some symptoms or pain for a couple of weeks. Treating just the symptomatic or those local trigger points can be effective to getting those desired effects. However, as you move from that acute patient population to more subacute and then more chronic type of pain, which is a lot of what we see in pelvic health, we need to expand the treatment methods to be more global. So the integrative dry needling model supports a more comprehensive view that moves away from the limited point-based treatment and provides a more expansive approach toward that global assessment and holistic treatment. I'm going to get into a little bit more of those principles. So Dr. Frank Gargano, he was the founder of the Integrative Dry Needling Institute, and he presents this conceptual model to describe musculoskeletal pain and dysfunction as systemic issues, which is where neurologic dry needling aims to address, and neurologic dry needling is the type of needling used in integrative dry needling. So this model is built around what's called the 3 I's and the 3 S's, which I'll get to in the next slide. But your 3 I's, inflammation, irritation, inhibition, they are all interconnected, and then they present as symptomatic, segmental, and systemic levels. Those are the 3 S's. Firstly, the 3 I's, you have again, inflammation, irritation, inhibition. Research shows that dry needling has a normalizing effect on all of these 3 factors. The more we read about inflammation, the more it becomes apparent that it is often central or even at the root of a lot of pain and dysfunction. Where you have inflammation that creates irritation of what we call the peripheral nerves that then create the sensory experience of pain. And then you have what we call like motor effects that drive neuromuscular inhibition, which is essentially just reduced muscle function. If inflammation could be managed more effectively, then we might be better able to mitigate its effects on both pain and dysfunction. So for example, following an injury, you would have the inflammation that would reside in the local tissues. However, it would quickly become widespread or systemic over time, and then start involving multiple other tissues, and then involving the nervous system as well, which is what we see like that cycle in more chronic pain. So the 3 S's, they integrate with the 3 I's, where inflammation produces pain and dysfunction. That can be local or symptomatic. It can be segmental, or it can be systemic, and it can also be a combination of all of these two. And that's what kind of creates the challenge with treatment. So your symptomatic or your local points, this is the most obvious type of pain. It's usually someone coming in and they're like, I have pain right here, like that's the spot. This is usually in that acute patient, subacute patient where it's staying more localized. The area might be swollen, there might be some limited or change in range of motion because of that. Segmental is the effect on the spine. So PTs understand that when treating musculoskeletal pain and dysfunction, the spine can't be ignored. And it's why we're first trained to kind of clear the spine. When we're doing an assessment, we're always checking your back and your hips almost first in the assessment. So when we clear the spine, that reduces the likelihood that we are missing some type of segmental problem coming from the spine, based on some type of peripheral complaint or issue elsewhere in the body. The segmental effects of needling help to reduce the symptomatic or the local effects. So systemic, this is kind of the interesting one. So we have in the human body shared neurology, circulation, and physiology that we can't separate into pieces or parts because it's all connected. So we base our systemic treatment on what is called homeostatic points. Homeostatic points are key neurological areas in the body that have stronger therapeutic signaling to the nervous system. And these are points in the body that are, they're present and reproducible at specific locations. So if I was like trying to address some back pain, I would needle, maybe if you had a spot that was actually symptomatic, painful, and tender, I would needle there. And then I would also look at, while I'm there, let me go ahead and needle a homeostatic point that's in that region too. Yeah, so this is just kind of in contrast to dry needling that just focuses on the trigger points. They might be missing out on other things. So the 3 I's and 3 S's are all interrelated. So again, if you're not addressing each of them, then you might be missing something in the treatment. When identifying and addressing all of these factors, this will increase your chances of having that more complete and faster healing. So this is kind of getting to this chart, how they are all connected. And then here, a quote, "You can get to the point but miss the system," which is a quote that I really like. And it's why I really like this approach of integrative dry needling, because I feel like it helps me definitely address what the concern is, but I'm also looking at what's happening in the rest of the body. So how can needling help you? I want to provide an analogy or like an example to kind of put some of the pieces together. So thinking about what that tight muscle is, or like that muscle tension is, you can think about making a fist and thinking about what happens when you squeeze your fist really hard. You might notice a change in colors of the knuckles. They might turn white or a lighter color. So when you make a muscle contraction like this, acetylcholine gets released into the neuromuscular junction to allow that contraction to occur. Over time, on a cellular level, you have your muscle fibers, we call them sarcomeres. Over time, those sarcomeres will start to shorten if they're being held in like a tight, tense position. And then you might develop a taut band in a muscle related to that. So you might develop a taut or palpable tender area in your forearm, for example. It might be tender, then it might become painful over time. There's also an energy crisis because you now have a higher metabolic demand from that muscle contraction, but you also have reduced blood flow to that area. That's why your hand would start to change colors. This effect brings in sensitizing chemicals and those inflammatory mediators that if you hold your hand tight long enough, it'll start to become pretty sore and uncomfortable. What dry needling does is provide a stimulus to this neuromuscular tissue. So it goes in and helps to break that inflammatory cycle, to then reduce the muscle guarding. which would increase blood flow, and then help to ultimately reduce some of the sensitizing and inflammatory chemicals that were sent to that area. There's also a vascular effect around the area from the trigger point, where this is pretty interesting, but it's where tissue resistance that occurs from tissue tightness actually creates a backflow of a blood flow to that particular region. So then you have those tight muscles that, when we're saying we want to have improved circulation, it's not, it's really because blood is even having, or I should say, blood is having a hard time getting there, but there's also like a pushback of that blood away from that site. So the idea with the needling is if you can get in and around this zone, you can, again, reduce the muscle tension, increase blood circulation to the area. But then going back to my previous slides, the reality of it is, from more recent literature, it's going to be more of a system problem than just a local problem. So that's just where the kind of integrative dry needling approach comes into play, where we're definitely treating that symptomatic area, but then pulling in other points, potentially around the spine or some homeostatic points too. And then this is just a little breakdown of what dry needling can do more generally. So many benefits of dry needling, because it manages soft tissue inflammation and helps to positively influence the nervous system. Some of the benefits you might have is that increased blood flow, release of muscle tension, decreased pain, increased range of motion, increased muscle strength, and then improved daily function. But these benefits are important because a lot of chronic and recurring pain is often due to a loss of microcirculation. So needling these areas to help just really increase that blood flow and reduce inflammation helps to normalize the body's physiological process, or what we call kind of bringing it back to homeostasis. And then how can dry needling be applied to pelvic health concerns more specifically? So going back to the beginning where I was talking about, there's really no one size fits all approach. These are just some examples of what I would do for some common pelvic health conditions, but it's always different patient to patient with other things I'm bringing into their treatment. But the first picture is just indicating a C-section scar. So your scar is still healing 18 to 24 months after surgery. So that just means there's plenty of time to be working on that soft tissue. Dry needling can help with tightness and just pulling, tugging sensation around that scar you might feel, or other parts of the abdomen even, numbness or swelling around the scar too, pelvic pain, painful bowel bladder issues, difficulty engaging the core, sometimes urge incontinence too, really just anything related to having that C-section, working on that fascia. Not even just the scar, but you can see down here, being able to needle the whole abdomen. I wouldn't be drawing all of these lines, but you can needle the whole abdomen. So next to this is just showing a needling technique for the tibial nerve. I call it tibial nerve stimulation. So this is showing how I connected E-stim to the needles for urinary urgency, frequency, urge incontinence, all those kind of overactive bladder symptoms. So electrical impulses would go up the tibial nerve to the sacral nerves, which are responsible for a lot of the pelvic floor function and urination. Stimulating the sacral nerves can help to calm down that overactive bladder, which can lead to a reduction in those symptoms you might have. You could also do the same thing just with electropads too, if you weren't ready to try the needling, and it would achieve the same. So this is just a picture of needling to the lower lumbar and the gluteals. This one I had needled some of the symptomatic points, and I also needled a homeostatic point on each side for that patient. Another common area for needling is anybody with tailbone pain. So I'd be needling gluteal attachments, back as well, sometimes into the relevant ligaments around there too. And then abdomen, you can do a lot. I actually do a lot of abdominal needling. So this is for anyone with like interstitial cystitis symptoms, endo, constipation, menstrual cramps too. It helps. So I do that quite a lot. And then the next two images demonstrate how working on one part of your fascia can kind of help the whole kind of fascial like network in your whole body. So there is horizontally arranged fascia at the base of your head and these suboccipital muscles. And in your pelvic floor. So working on one helps with the other. Also releasing tension at the base of your skull, at the suboccipitals, helps the vagus nerve, which helps to calm the nervous system. So yeah, that's a very common area I would do needling. And then this is just some other more symptomatic points that I had. Yeah, and then the next one is another common site, the TMJ, jaw pain, clenching. Up here was for temporals too, for like headaches, for example. So there's a correlation between chronic pelvic pain, stress, anxiety with people suffering from TMJ or any jaw pain, headaches. There's fascial connections throughout the entire body and fascial lines that run from the jaw down towards the pelvis. And then there's even a connection at embryological development, just with the orifices developing at the same time. But the idea here is a relaxed jaw equals a relaxed pelvic floor. So sometimes it's not even quite what you think. I'm not maybe needling a pelvic floor muscle, but I'm needling areas that would help influence some change in the nervous system and change in the pelvic floor. And then additional patient care. So I always include some type of soft tissue work. This helps to kind of diffuse the micro lesions that I've deliberately caused from the needling in that region, helping to kind of keep blood flowing and circulating. Another recommendation is on exercise and movement. That is very important to reinforce what we call that neuromuscular re-education and changes that were made to the tissue. This is neuromuscular re-education because when you reset the muscle spindle fibers, you don't want them to have the opportunity to get tight and like contracted again. So when you follow up with some gentle movement, exercise, stretches, walking, you're directly impacting that neuromuscular re-education. So you're having more optimal tissue and ideally better movement as well, movement patterns. And then just practicing that with repetitions to kind of make that your now normal movement. And then patient instructions. This varies patient to patient, but generally I am recommending hydration. So recommending drinking half your body weight in ounces of it, pure plain water, maybe applying some moist heat to the area to help with further relaxing it. Taking a walk after to encourage that new soft tissue normal that we work to achieve in the clinic. I'll provide recommendations on follow-ups, but that also kind of varies patient to patient and what their response is like. Everybody actually responds differently to dry needling. Some people have a dopamine release, so they feel energized and happy after. Other people actually feel kind of lethargic and need to take a nap afterwards. Sometimes when I'm working with athletes, it really varies on their response, like their performance with the needling. Some people actually they perform better after the need, or they perform better, yeah, after the needling. So we'll set up a session before their event or something. Other people, it needs to be something like post that event because it just changes their performance. And it's not their best, or they have more soreness or something. So that just varies kind of person to person too. So I really want to note how the patient responds, how they felt, and then report back so I can adjust the treatment as necessary. It might look like adjusting where I'm needling, the dosage of the needling, and what type of needling I'm using too. There's a lot of different needling techniques, from just letting the needle sit in the tissue, pistoning, which is a little more aggressive. There's usually more soreness, and the electrical stimulation, which really helps with that muscle pumping and just better flow through the body. So it just really depends on everybody's response. But yeah, so that's all that I had right now. Let me know if you have any specific questions, and we should have a blog up on whole body healing with integrative dry needling for reference too. But yeah, thank you.